you who are not familiar with the Alliance, it's a truly important resource for our state, both as a source of objective information about performance of healthcare systems, but also as a place where all stakeholders can come together and have dialogue: purchasers, plans, providers. We have some tough conversations, I can assure you, but that's how change happens. It's the willingness to bring tough issues to the table, have empathy, as Dorothy demonstrated, for our partners, and make lasting change. My connection with the Alliance actually goes back to its creation. Ron Sims, as King County executive, had an idea to form a task force, and it was a task force that actually produced a result. It was one of those blue ribbon task force where there was no dust settling on that report. The key recommendation was to form this alliance, and we did that in 2004. And in the 11 years since, we've seen the Alliance make tremendous gains, establishing a national reputation for fairness and objectivity in reporting. Nancy has been with the Alliance as executive director since September 2014, and in that short time, she's already steered the organization through a tremendous amount of change in an ever-changing healthcare landscape. Nancy's background is as a hospital administrator, so she's intimately familiar with the challenges of that system. She took a little detour and was the executive director for Foster Pepper Law Firm. So this woman has managed physicians and lawyers. I don't know if there's anything Nancy cannot handle. So please join me in welcoming Nancy Giunto.
So let me add my thanks to you all for being a part of this today. This issue of value-based purchasing is something that the Alliance is very passionate about. We really do believe that purchasers have a pivotal role to play in moving the market. I loved what Rick said this morning about the things that you should demand and ask as purchasers, and I wanted to add just a few thoughts, which is that as purchasers in the state, I think that you share common concern that Washington be an excellent place to get health care and high value from a competitiveness standpoint, right? We want the state of Washington to be the best in the nation. And as all of our businesses, including mine, attract and recruit new folks to the state, I am often asked, how is health care in the state? I was asked that a lot at the law firm as we recruited. So I think we share that common thread. And another common thread that we share is, the $10 billion that Dorothy talked about as the investment in healthcare just for the purchasing that she makes on behalf of the state is funded by somewhere. And that funding comes from the taxes that we pay as businesses in the state. And so we have a vested interest because we care about this for our employees. And we also care about this because we want our state to be competitive, and after all, we pay a big part of the bill. So there are many reasons. So I just want to touch here briefly. Caroline and Rick both gave a really nice introduction to the work of the Alliance. We really are the place that brings stakeholders together for the tough conversations. Our members span all the interest groups in healthcare in the state, and that makes for our rich conversations. Our mission has already been described to you by a couple of speakers. Our vision is important to point out to you in that we really aspire, by working together and collaboratively, we achieve the top 10% performance in the nation on healthcare value. That is what we aspire to, and we understand that no one of us does this alone. We have three overarching goals: reduce the price of healthcare services, reduce the overuse of healthcare services, reduce underuse of effective healthcare services. And we believe that measurement and reporting are the way to get to that work. We're really happy to see so many Alliance members in the room. This is just a few of our 183 member organizations across the state. Tremendously hardworking people who I think also have some fun together. trying to tackle the complex issue of just how it is we do a better job in healthcare in our state. So I want to talk just a minute about performance reporting as a core competency. The Alliance runs a very robust all-payer claims database, or you might know this as an APCD. We've been voluntarily running this database back to 2004. We voluntarily get claims level submission from 30 data suppliers, all the major health plans in the state, Medicaid, and several self-insured. This includes the Medicaid population, and the reports I'm going to share with you are driven from claims-based data. That's how we do our empirical reporting. So I also want to share with you we're a nonpartisan nonprofit. We rely on national benchmarks. We're looking to add value to the conversation and to convene the conversation. And that's really our role and mission. So my focus today really is to help you dive into the reports a little bit, hoping that it will spur questions for you and encourage their use, and also that you can give us feedback about what might be helpful to do different in the future. So I'm really going to focus on two key things. You know, how could the Alliance help you answer questions that you get from your employees? How could these materials be of assistance to you in that regard? And secondly, how might you use these materials in strategic benefit design? So first, I'm just going to pose a couple of questions. Undoubtedly, purchasers in the room have heard these questions. How in the world do I choose a primary care physician on something other than just what my neighbor tells me has been a great experience, or a clinic that's close to me? How do I think about the patient experiences who see this provider? How do I think about the quality of this provider? So how do I choose a primary care doc? How do I find high-value maternity services? Where do I turn? How do I know the distinction between maternity services if I'm in need of that sort of care in my future? What if I have a major surgery that my doctor has recommended to me? How do I know where to get the surgery, whether this is something that I should get, whether I should consider watchful waiting, whether there's a difference in how these surgeries are performed across the state that might lead me to question my provider a little more? So everything around how do I make a decision about a major surgery? And then, are there just certain procedures that are overdone in my community? And should I be aware of this in a way that when I see my doctor, I'm an informed consumer asking good questions? So that's employee questions. Probably you might have some of those as a consumer of your care as well. I know I do, as does my family. So then on the benefit design side, how can I incorporate quality measures into health plan contracts? How do I actually do that? And what exactly are these performance measures, and why do they matter? How do I shop for a health plan on something other than price? When I look at health plan alternatives, I see coverage, I see deductible differences, I see out-of-pocket differences, but what beyond price can I learn about to purchase a health plan? Things like quality of the health plan, how a health plan promotes safety and transparency, how they engage with consumers. Are there third-party pieces of information reports that can help? And then I'm really interested in this idea of an accountable care organization. Where do I begin? What questions should I be asking? Are there guidelines? What docs should be in or out of the network? What hospitals should be in or out of the network? And so the Alliance work hopes to make some of this a little bit more manageable. So this starts with having employees understand what high quality care, high value care means. We've looked at the savvy shopper. I won't spend a lot of time on that, but just to touch upon the fact that to the Alliance, high value care means high quality care, a positive patient experience, and at a fair price. So just like Olivia, Michael, and Ann are shopping for those three components, so too we believe that each of those components are the things you should be asking about as purchasers as you design your benefit plans. and that we have to help consumers understand it's okay in healthcare to ask about these things, just like they do in every other purchase that they make. We create reports around each of these aspects of care. My dream is that someday we have the robust database and other technical know-how to bring all of these elements together. But today I'm going to be sharing with you reports that touch upon each of these three elements in anticipation of that bright, wonderful future. I would also say another benefit that we see about value-based purchasing is, by its very definition and nature, it requires a closer relationship among the employer, the provider, the plan, sometimes even the consumer, because there's this notion of financial risk that gets built into the equation. And we think that through collaboration and through interaction, much like we're doing this morning, understanding the various points of view are really what moves the market. So the Savvy Shopper has been very popular today. I'm not going to burden you with more time on this, other than to say that if you haven't noticed in your blue notebooks, we have the informatics that go with the Savvy Shopper. So not only is there a video presentation, but if your employees learn more from infographics, things you might want to put on your website, here they are. And then there's also a companion piece that, just like in the video, those three personas came together for value-based purchasing, so too you have that on your materials. And the Savvy Shopper is available on our website as well as on the Healthcare Authority's website, and you are welcome to use that. And if you want a different version of these in some way, just give us a call and we're happy to provide that. And our goals are not only to help consumers be better purchasers of care and help you educate your employees, we'd really like the brokers, many of whom are in the room, to think about using these materials when they're advising the employers with whom they work on benefit design, and the health plans who ask for their customers are asking them for help. You know, what should I care about in my health plan offering? So let's talk a little bit about quality. Here's the informatics, and again, you have these handouts in your materials. So measuring healthcare quality in the state of Washington, the Community Checkup is our signature annual report. It highlights healthcare quality at both the medical group and the hospital level, and you have this document also at your seat. It's the most recent report was released in December. It includes results for medical groups of primary care providers where there are 4 or more providers practicing together. We reported on 14 of the counties in our state. There are 39 counties in our state. We know that one of those counties doesn't have a primary care group of 4 or more, so next year you'll see a report on all 38 counties in the state. We also view this as a report card, if you will, at both the clinic and the hospital level. And the way we develop this report, you might be interested, is that we engage our Quality Improvement Committee, that's 22 providers across the state, usually senior level physicians, but not exclusively physicians now, to help us with what we study and why. So we get the clinicians involved from the very start, which means that when they see the report, they're bought into the results because they helped to choose it. Dorothy mentioned that there are areas of focus within the common measure set. The last community checkup that we released in December of 2015, our 9th community checkup, included 52 measures. We mentioned that 3 more have been added by the governor-appointed committee. And the areas of focus for the common measure set are up on the screen here: prevention, acute care, and chronic illness. And cutting across each of those measures are the patient experience. There was a question that I thought was excellent from a colleague from UW about proliferation of measures. We understand that, and we hope to help add to administrative simplicity as we continue to work across the state to encourage this group of common measures, selected by 3 expert work groups across the state, reviewed by yet another subgroup to say, yep, these are the measures to start with in the state of Washington. will catch some momentum and will be the things that we use. There are also handouts again in your blue folder that talk about the common measure set on an easy, simple one-page sheet of paper and why it's important. And so I'll also call that to your attention as a way to help educate. So the single most common theme of the community checkup, and as Dorothy has said in all measurement really, is the tremendous amount of variation. And what that means, if you think about it every day, is that thousands of Washingtonians are receiving very high quality care, and unfortunately others are not. So the variation really does coincide with the type of care that people are receiving, and we'd like to work to reduce that variation. So here are some key findings beyond variation. We have a long way to go to consistently be in the top 10% of national performance. I mentioned that was part of the Alliance mission. The good news is there are some provider groups and hospitals that get there, not consistently across all measures, but we have folks we can learn from right here in our community, and they're very willing to share. So it does show that local successes prove that delivery of high quality care is possible. And for many measures, unfortunately, there has not been very much improvement over time. And in part, that's because the nation continues to do better. States across the nation continue to do better. And as they move their benchmarks up, the national average gets tougher and tougher to reach. And so it's a constant challenge for us to get to that place. I like to think that the state of Washington is the best in the nation, and we should be there and always strive to be there. Okay, so let's take a look at this report together, just so I can familiarize you a little bit more with it. I'd like to ask you to turn to pages 26 and 27. So I'm looking now, yes, at the very thick report that looks like this, Measuring Healthcare in Washington. Okay, so on pages 26 and 27, these are the prevention and health screening measures. I think there's little debate about the importance of detecting a disease early on so that it can be treated successfully in its early stages, resulting in fewer complications and less financial risk. And on pages 26 and 27 of this report, you'll see that we look at two measures. Well child visits ages 3 to 6 and adolescent well care visits ages 12 to 21 for both the commercially insured and the Medicaid insured population. If you look at the graph for just a minute, you'll see that our state falls significantly below the 90th percentile on these measures, which gives us a marker for improvement. And as you look at this, I wonder if you can answer the question in your organization, how well does your employee population do in getting well visits for kids 3 to 6 and adolescent visits for kids 12 to 21? How would you stack up here? Do you know that information? And if you don't, I would posit should you? And how might you learn more about that? So page 27 of that same report also shows us there's significant improvement in adult screenings on the 4 measures that we follow, that of breast cancer, cervical cancer, colon cancer, and screening for chlamydia. And I would ask you again, screening, very important part of the Affordable Care Act, common knowledge. We read about it regularly in magazines and newspapers. If you were thinking about your own employee population, do you know how well you do on these screening measures? And if you don't, how might you find out, and would you care to know more about this? On pages 28 and 29, so if you flip just one more page, you'll see this variation between medical groups on this set of 4 measures. You'll notice that there is a diamond shape that shows the average in our state. You'll notice the variation around the average, and then the brown bar, which is the NCQA 90th percentile. That's a widely accepted national standard for national excellence in quality of care. So first of all, notice the variation. Think about those who are above and below. If you're in a provider community, how do you work to decrease that variation? And so what's the bottom line about all of this? Not all medical groups practice at the same level of quality for these important screening and prevention measures. Do you know which of those medical groups are in your network or not? Do you know which of those medical groups are visited by your employees or not? And do you care? Is there something you'd like to do differently as you think about benefit design? So I'm going to move on now to a second report. We've talked about quality, and I'm going to turn our attention to a second report called the patient experience. We do this report every 2 years. This is our third report. It includes medical group level and clinic level rating on the patient experience. And so what exactly is the patient experience? So patient experience focuses on the critical interactions that patients have during their healthcare encounter, during their visit to their physician. And this is based on primary care physician visits. It measures whether or not and how often important things happen to engage the patient in his or her care. It's positively correlated with health outcomes, really important, positively correlated with health outcomes, in part because patients who are engaged with their provider are more likely to follow his or her advice. Stands to reason, correct? So in contrast, patient satisfaction measures how happy a patient is with his or her experience, another important metric, but not correlated to outcomes in our work. So we're very focused on patient satisfaction, on patient experience. Last week at an All Alliance meeting, we released results, as I said, from our third report. We publicly reported on 75 medical groups, shown on this slide, 266 clinics. We started this work by mailing out 181,000 mail surveys across the state. We had a 31% response rate. We thank our health plans who help us identify the patients to include. So next year, next time we do this in 2017, we will survey in all 39 counties, maybe 38 counties, depending on the number of providers there. And we hope we have as good a response rate and have the kind of support that we have had. So here are the questions that are asked in the patient experience survey. The questions are grouped into these 5 broad categories. And again, pay attention because these categories are the categories you should think about coaching your employees to ask as they're going to talk to their providers. Is there ease in getting timely appointments, care, and information? How well do providers communicate with patients? How well do providers use information to coordinate care with other providers? Are office staff helpful, courteous, and respectful? And what type of overall rating would you give the provider? So we asked these questions to all of these survey respondents. They were remarkably engaged in wanting to support. Susie Day leads this effort in the Alliance, and some of the patients even call her and thank her for the opportunity to respond to the survey. So they're very engaged in this work. And let's now look at another document that you have in your blue folder. It's entitled The Snapshot of the Patient Experience in Washington State. It's a document that is stapled together. It looks like this. Snapshot of Patient Experience in Washington State, February 2016. Everybody have this from their blue folders? Okay, so the full report is available on the Health Alliance website, but this gives you a snapshot, and let's just look at this for just a moment. If you open that 2-page handout, you're going to see a chart that looks like this on 2 pages. This is the ranking of the medical groups in the state of Washington, whose patients are saying, did this medical group perform at average or above or below average on those 5 main questions in the patient experience? And you can see that we have some medical groups that perform extraordinarily well. and some perhaps opportunities to learn from those who are excelling. There is a difference in the experience that patients have with their primary care providers in our state. And I would hope that you would think about using this information as you think about your benefit designs, encouraging your providers to meet these marks of excellence, and holding them responsible with the care that they provide to your employees. So too, on the last page, the Alliance did some work. This is page 4 of this document now. Looking at a link between the patient experience, the important elements of the patient experience, and the overall rating of the provider. And so if you were coaching your employees on the 9 things to expect that should be a part of an excellent patient experience, here too is a tool for you to use. We found through our research that these items correlate to a positive patient experience and a high rating of the provider. Okay, so now we've done quality and the patient experience, and we're going to turn to the third, which is the hospital sticker shock report. This was referenced by Dorothy in her comments this morning. I'm going to do just a little bit of a deeper dive here. Unfortunately, we have limited information to the actual cost of data from claims information. To this point, our voluntary database has not included cost information. Last May, signed into legislation was a mandated all-payer claims database that would include cost information. So we're hopeful that we will be a part of using that information, hopefully even leading the development of that WAAPCD for the state. Despite the limitation on cost information, we did develop this report called the Hospital Sticker Shock Report. And I see that many are holding this up. This is the bound edition. And I also noticed that our printers yesterday had just a little bit of difficulty getting these pages aligned. So this is now just to see if you're awake, if you open this. Some are up and down. Talk about quality control. Here's a place where we fell short. You didn't notice that? Good. We'll get that corrected for next time. Okay, so the Hospital Sticker Shock Report looks at information on 12 common hospitalizations. We base this information on Medicare claims data. We summarize this information on yet another infographic that's in your materials called the Hospital Sticker Shock. We do these one-page infographics in the hope that you will share these readily with your employees, that it will help you to communicate information from an unbiased third party that takes you out of the hot seat. So let's look at page 12 of this report. Everybody there? Page 12. I don't know if it goes up or down. It's up. Okay. Okay, so I'm sorry, I want to turn us to page 32, excuse me, page 32. Everybody there, you should see a DRG on back fusion. Everybody got that? Okay, so just as Dorothy showed you, this is another diagnosis-related group that looks at the difference between the highest hospital price and lowest hospital price on a common back surgery called fusion of the back vertebrae. And again, here you can see a very wide variation in price, low of close to $62,000 all the way up to $193,000 in the cost of this procedure across hospitals in our state. That's a $131,000 difference for patients who had a similar illness burden. We adjust for illness burden as we do this work. This procedure is not an outlier. As you look at this report, you would see that most every procedure has quite wide variation. Variation of 200 to 400% is not uncommon. Now, you may be saying to yourself, okay, this is great. I don't have Medicare patients in my population. I'm not responsible for Medicare populations. And so I would say that while this is an imperfect proxy for cost information on commercially insured lives, it's still important information to pay attention to, and I'll tell you why. A hospital sticker price, the price charged to Medicare, not actually gotten from Medicare, is often the starting point for negotiations in hospitals. Having been a former hospital administrator, I can tell you that you have a rack rate or sticker price to start the negotiations. You may also want to think about this in terms of your employees who have larger out-of-pocket expenses with the way you've designed your plan. So if they're going to one hospital over another, both of whom are in your network, they're participating at a different level. And finally, I would say that you should think about this by looking at your own population. Undoubtedly, well, I shouldn't say that because I know not all do. I'm hoping that you see within HIPAA guidelines good reporting on your group of employees. Take a look at some of these common procedures. See how many back fusions are in your population. How many total hips or knees are in your population. See what you've paid for them. And glance at this chart and think about, are you getting a good deal, an average deal, a not so good deal? Now knowing what both the charge range is in terms of sticker shock and also what Medicare pays. Okay? So no surprise, there's significant variation in pricing among hospitals, just as there is in medical groups. All right, so now I've taken you through the importance of value-based purchasing. I've talked to you about the three components of value, cost, quality, and the patient experience. And I would just invite you to stay engaged in this very important topic at whatever level you are interested in. Certainly, we would invite you to be a part of the Alliance and would welcome all comers into that group. We really do believe that collaboratively, working together, we can move the market. And I love this slide. This really speaks to the power of collaboration. Alone, we're smart, but together, we're brilliant. So thank you for being a part of this today. I'm happy to answer any questions as time permits. Thank you.
Nancy, this is really inspiring. I was the first director of the Healthcare Purchasers Association in 1982, where Boeing and Weyerhaeuser and others tried to put this all together. And then I worked in healthcare for 30 years. And the difference is you've got data that's phenomenal. I would have given anything for that data. Back in 1982, where we said, you know, it's at 9% of the GDP. Can you believe it could get any higher than that? So it's gotten a lot higher. I think the thing that's important to say is this is tough. And there's a reason that we know so much and so little is happening. I commend so much Dorothy's work, and I know everybody is good, and I'm not trying to point any fingers, but the resistance to this is going to be horrendous. When you start with the bundling initiative, there's going to be resistance to that. The fact that the consumers, even though they're paying these enormous deductibles, still want their own doctor and really aren't getting that engaged in this product, there's going to be employees who are upset. And I think we need to be supportive of those who take the steps, take those courageous steps to create change. Once it starts happening, I think it's going to move very rapidly. But this is tough. It's not easy. And I think we need to commend those that are willing to step forward and take the risk. This is excellent work, and I'm cautiously optimistic that 3 or 4 years from now we actually might see more change than I've observed since 1982.
Thank you very much. It means a lot.
So, bravo, Nancy. What I wanted to add, which actually one of the comments that came up at our prior discussion, I think has relevance here, is getting senior management, getting executive buy-in to these kinds of changes. And Angela was saying it at REI, she thinks they're beginning to look at how, being willing to consider different programs for different, segments of employees. And so perhaps even as some of these leaders come out and do this, if you can help explain this to your senior management as a way to prepare them, because it does take a tremendous amount of courage, and the degree to which we can have executives, and that's why it's been so great that the round table is a member of the alliance, and that we have a member of the round table CEO is on the board, and now we have a number of healthcare people. So we need to get this on top of mind for CEOs and other executives, and that will help kind of foster some of the courage.
Thank you, Mary.